And we're joined now by Terry Tanilian, Senior Advisor on Veterans Affairs. So earlier, Veterans Affairs announced all veterans exposed to toxins and other hazards while serving in the military at home or abroad, they'll be eligible to enroll directly in VA healthcare. That's starting on March 5th. So what does this mean to people in North Carolina, really here in the Carolinas as a whole?
Well, thank you so much for having me, and thank you for talking a little bit about this great new announcement. So what it means is that veterans in North Carolina who may have served in the Vietnam War, the Gulf War, deployed to Iraq or Afghanistan, or any other combat zone after September 11th, or even if they deployed to another location in the support of the global war on terrorism, they are now eligible to apply directly for VA healthcare without first having to apply for VA disability benefits. But also veterans who never deployed but may have been exposed to toxins or hazards while they were in training or on active duty. And even here at home, maybe they were working with chemicals or pesticides, they're also now eligible to enroll in VA healthcare.
How big of a difference does this make to those families of those eligible veterans?
This could be really life-changing and life-saving. So we know that VA care is proven to be the best. At VA, they'll get appropriate screenings, access to preventive services, and so that if they were exposed to hazardous substances, their providers would be ensuring that they get the follow-on tests that they may need so that those conditions may be detected early and treated early, which can be life-saving.
As far as just how many people will be affected by this, is there an average number or an idea of just how many people will be touched by this change?
Well, we know that these populations that we described as millions of veterans, but many of those veterans are already enrolled in VA healthcare. We do think that this will impact hundreds of thousands of veterans over the next 10 years, and we encourage them to come in, check it out at va.gov/PACT, and see if they can get enrolled right away.
So what's the real goal for this initiative? I mean, it just sounds like a really good thing, but what is the real goal or the hope for the future with this?
So the PACT Act outlined eligibility for their enrollment in healthcare over the course of the next 6 years. So we're speeding it up. We're saying there's no need to wait 6 years. We've got the resources and the staffing we need to serve these veterans now. So we're trying to make sure that they can get access to this world-class healthcare sooner. And so starting March 5th, they can enroll and start getting access to those screenings and preventive services and more.
All right, Terry, thank you so much for joining us today. Definitely something we'll continue following going forward.
Thank you so much for having me.